Hey, what is the plan today? Today let's discuss 4 5-mark questions from 2012 Physiology question paper. Okay, we can meet at the classroom. Sure.
Hey, it's getting late. Shall we start studying? No, they will come. Let's wait for few more minutes.
Hey guys, are we too late? Sorry for being late, friends. We were stuck in the traffic block.
That's okay. Let's start today's section. What is our plan today?
Today let's discuss 4 5-mark questions from 2012 Physiology question paper. Okay then, somebody read the question. What is the first question?
The first question is functions of thyroxine. There are 3 hormones produced by thyroid gland. They are thiodothyronine or T3, thyroxine or T4, and calcitonin. Thyroxine is the primary hormone which is secreted by the thyroid gland.
What happens if the level of thyroxine increases? Hyperthyroidism. Hyperthyroidism occurs when your thyroid gland produces too much of the hormone thyroxine. It can accelerate your body metabolism, causing unintentional weight loss and a rapid or irregular heartbeat.
What are the functions of thyroxine? Thyroxine plays an important role in controlling body metabolism, temperature, regulates the functions of the heart and the digestive tract. It also keeps the bone strong. Control the muscle growth.
What is the second question?
The second question is electrocardiogram.
An ECG is a medical test that detects cardiac abnormalities by measuring the electrical activity generated by heart as it contracts. The machine that records the patient ECG is called electrocardiography.
A normal ECG contains waves, interval, segments, and one complex. A positive or negative deflection from baseline that indicates a specific electrical event is called a wave.
The waves of an ECG include the P wave, Q wave, R wave, S wave, T wave, and U wave.
The time between 2 ECG events is called interval. P wave, which represents the depolarization of the aorta. QRS complex, which represents the depolarization of the ventricles. T wave, which represents the repolarization of the ventricles.
How is ECG procedure done?
Plastic patches that stick the skin are placed at certain spots on the chest, arms, and legs. The electrodes are connected to an ECG machine by lead wires. The electrical activity of heart is then measured, interpreted, and printed out. No electricity is sent in the body.
What disease can ECG detect?
ECG can access the heart rate and rhythm. This test can often detect the heart disease, heart attack, an enlarged heart, or abnormal heart rhythm that may cause heart failure.
Okay guys, we have successfully completed 2 5-mark questions. What is the third question? The third question is oxygen dissociation curve.
The relationship between the partial pressure of oxygen and the percentage saturation of hemoglobin with oxygen can be represented graphically. This graph is called oxygen dissociation curve. Shift to left indicates the dissociation of oxygen by hemoglobin, and shift to right indicates the dissociation of oxygen from hemoglobin.
The saturation of hemoglobin with oxygen depends upon the partial pressure of oxygen. When the partial pressure of oxygen is high, the hemoglobin accepts the oxygen, and when the partial pressure of oxygen is low, hemoglobin release oxygen.
When the partial pressure of oxygen is 25 to 27 millimeters of mercury, then hemoglobin is saturated about 50%, that is, the blood contains 50% of oxygen.
The partial pressure at which the hemoglobin saturates in 50% is called P50.
At the 40 millimeters of mercury of partial pressure of oxygen, the saturation is 75%. It becomes 95% when the partial pressure of oxygen is 100 millimeters of mercury.
We have completed 3 questions. Let's go for the fourth question. The fourth question is cerebrospinal fluid found.
CSF is a clear, colorless liquid that fills and surrounds the brain and spinal cord. It replaces the body fluid found outside the cell of all bilateral animals.
Location of CSF. CSF occupies the subarachnoid space and the ventricular system around and inside the brain and spinal cord.
Actually, what is subarachnoid space?
The space between the arachnoid motor and pia motor is called subarachnoid space.
What are the functions of CSF?
The functions of CSF are protect the brain and spinal cord from trauma, supply nutrition to nervous system tissue, remove waste products from cerebral metabolism. The primary function of CSF is to cushion the brain within the skull and serve as shock absorber for the central nervous system. CSF also circulates nutrients and chemicals filtered from the body.
Okay guys, we have completed today's portion. Let's meet tomorrow with new questions. Hope this group study was useful to you all.